Thank you very much, Steve. And we start here tonight. At least one expert has called for calm with regards to the divisive issue of the National Health Insurance Bill. Momentum Health Solutions Executive Damian McHurgh was speaking at the company's Healthcare Insight Summit, which has found that 6 million working South Africans are not covered with medical aid due to the hard financial times. Our business reporter, Ntokozo Khumalo, caught up with him and filed this report.
Momentum's Healthcare Insights painted a picture of the state of South Africa's healthcare sector, and to give us a little bit more detail, we are now joined by Damian McHurgh, who is an executive with Momentum Healthcare Solutions. Thank you so much for your time, Damian. As a starting point, perhaps just give us an overview of some of the trends that this year's Healthcare Insights found.
I think a few things. One, it can't be a healthcare insights if you don't talk about NHI. So where we are with NHI and what's happening with the national healthcare system. I think the second one is the performance of medical schemes and health insurance just generally across the industry. So we gave some updates, if you like, on what's happening within that marketplace. And then lastly, I think very importantly, is the state of mental well-being and mental health within not just within our country, but just some of the trends across mental well-being in South Africa, but also in the world, and the importance of managing our mental well-being and how we can do that. So that was really the focus of what this insight session was about.
And one of a major concern for a lot of South Africans has been the NHI Bill, which really is supposed to close that gap between affordability and quality healthcare in the public and private sector. Talk us through where we are with that NHI Bill and what some of the major concerns are, but what it could do to improve the state of the healthcare sector once it starts rolling out.
I think firstly it's just maybe calm down a little bit. I think there's such a lot said about NHI, and there's a lot of worrying and almost fear-mongering. And I think while it's important that we understand the journey that we're on and the pitfalls of the journey that we're on, we must also look at why we need it. The healthcare sector, both in the private sector and public sector, isn't perfect. In both sectors. I'm not standing here saying the private sector is perfect either. And there's a lot of imbalance in our sector. We spend almost the same amount of money equally in both sectors, just broadly, but the sectors cover very different amounts of people. 9 million people in the private sector and 51 million people in the public sector with the same quantity of money. You can imagine the imbalances that exist within that. So we need something to change. And that's what this NHI Bill is about. I think the challenges are how we change it and how we use both sectors to the benefit of one another in order to achieve the change that we require. We are South African. We are uniquely South African. We've gone about in our history about finding ways of changing things contrary to everybody else and doing them well. If you just think of 1994, most changes in political parties have come through violence, not ours. There's lots of things that we've done differently, very successfully so. We don't have to take the NHI system from the UK or the NHI system from somewhere else. We are uniquely South African, and we must look at what we have and build on that. We're very positive. We believe in it. We think it has to happen because of the imbalances that exist. It's how we get there. What we don't yet know is all of the facts. We don't yet know how it's going to be taxed. We don't yet know how medical schemes can function with it. And we believe that there's been a lot of submissions from not just us, but from other private sector businesses into that process, and we must continue to do that. So before it's implemented, it's more perfect than what it is now. Of course, there's challenges when you start something out, but we must work together to make that happen. It mustn't be one at the expense of the other, both together, working together for more South Africans to have more quality healthcare for less.
Damian, thank you so much for that detail. Of course, that was Damian McHurgh, who is an executive with Momentum Health Solutions, just painting that picture for us on the state of South Africa's healthcare sector and really pointing out that we should calm down when it comes to the National Health Insurance Bill that still has some quite of way to go before actually being streamlined. For Newzroom Afrika on Channel 405, I'm Ntokozo Khumalo in Johannesburg.